Okay. So how did you fall?
So I was roller skating in front of my house on the black asphalt.
Yeah.
I was fine, and then I rolled up onto the curb, which is rounded and with cracks, and I fell backwards, and so like flat on my back, and I felt like I fell flat on my back, but then like it was two separate things, but I felt my arm crumble, but I must have put my arm out, and then I couldn't get up. I mean, I knew something was not right.
One thing I'll say is that if we're recording, I just ask that you don't post this anywhere.
No, I'm just going to share it with my family.
That's fine, yeah. Okay. So you were roller skating, you said, and then fell back. Did you land on your hand that was outstretched like this?
I guess.
Yourself?
Yeah, I guess. I mean, I just remember the sense like came, and I even said to myself, like, don't do something stupid and like roll up the curb, you know what I mean?
Yeah.
And then I fell backwards, so that was my sensation. And then like the next was my arm crumbling.
Sure.
So I didn't hit my head. I don't have any scratches or anything like that, but I did fall backward, onto the ground. But yeah, it's weird. I don't have any other, I guess because my arm took it.
Well, that's good. I mean, you can always do worse, right? So,
Are you sure?
Happy that it's on your elbow. I mean, your head is okay. You're walking, you're talking. It's good.
Right.
All right. So, this is an injury of your elbow, which is called a terrible triad.
I knew it. I saw that in a couple of the images, but I didn't see that till last night because this, everyone has a different.
Yeah.
And I guess because it's looking from a different view, that's like the worst, right? So it's the worst.
So it's not. It sounds bad because of the name, but it is a triad of 3 injuries. So there's a dislocation of the ulnar humeral joint, right? So this is no longer in the joint here.
Okay.
There's a fracture of the coronoid, which you can see here. It's a little bit difficult to see on this view, but you can see it. And then you also have a fracture of the radial head. So that's the 3 injuries that make up the terrible triad.
Okay.
All right, so this is your x-ray when you came in. Okay, and just different views of that. And this is the CT scan after they reduced the elbow. So this is the coronoid fracture. You can see this chip here.
So it's like when you say chipped, the bone is chipped, or it's like chipped away.
Yeah. So this coronoid fracture is from a part of the ulna called the coronoid, and attached to it is the anterior capsule of the elbow joint, and that contributes to stability of the elbow, especially in extension. So that is one element of this. And then another is your radial head fracture. Okay.
Mm-hmm.
The joint, as it is now in your splint, looks like it's back where it's supposed to be.
Okay.
It's surgically reduced. Okay. So typically we do recommend surgery to fix this.
Yep.
You don't have to have surgery. This is a personal choice and totally up to you. I do think it is probably going to be the best option for you.
That's what I read too about the terrible,
But there are no absolutes. So it's not like if you have this injury, you have to have surgery. So it's always a choice. So if you want to discuss with the family, you can. So for the coronoid, typically what I would do is do drill holes through the bottom side of the ulna here, the dorsal side. And then repair this with a suture that's then passed and tied over a bone bridge on this side over here. And then for the radial head, it depends on what you find in the operating room. Based on the CT scan, I'm prepared to do one of 2 things, and that is to either fix it if I'm able to, or replace it.
Fuck. Okay.
Yeah. All right. So those are the 2 options.
Okay.
But it is something where we do need to have a good plan for pain management in the perioperative case.